Okay. All right, Martha, go ahead and feel free to introduce yourself and go ahead and start.
Okay, well, good morning, it's afternoon now, 3 after. Good afternoon, everybody. My name is Martha Polinsky. I'm going to go ahead and just pull up my PowerPoint and sort of start with that because I have my introduction and everything in there. Okay, can everybody see the PowerPoint? Okay, all right. So I currently work for Marshall University Research Corporation. I am the coordinator of the West Virginia Collegiate Initiative to Advance Healthy Campus Communities, which some of you are a part of. If you're not, that is a mouthful. We call it WVCIA. And I also work with a student leader project that we have that is partnered with WVCIA or supported by WVCIA, we should say. And so for me, I have objectives for us as well. So basically when Carolyn asked me to do this, she asked if a student would come up to you and say, I have this idea for a project, what should I do? This sort of evolved from that. So I thought I would start out by familiarizing you with WVCIA and my student leaders, what I do, and then take a little walk through the strategic prevention framework to sort of see how you can help your students using that, and then using these models to encourage your students to with whatever project they might have. Luckily, I have Tim on here today, which is nice because Tim works with us. He has a student leader that actually I work with, and so this is very applicable right now. This should be something that'll really come in handy for you. So my background, I have worked across the continuum of care. That means that I've worked in prevention. I worked in I actually was assistant director of a treatment center for several years. I worked in a medical managed withdrawal service, and then worked in prevention and harm reduction after that. So I have a pretty, for 15 years, full gamut of experience, mostly with substance use. However, if I fall into using substance use language, please know I'm talking about mental health as well. That mental health is part of that, or they go hand in hand on. Is going to affect other as well. So when I'm talking about that is a risk factor as well. So I am talking about that. I did coordinate a very successful county coalition in Wheeling, and I have a lot of experience with the strategic prevention framework, community organizing with the coalition and other things that I've been involved in. Creation of youth-led initiatives, and created new and amplified existing harm reduction was a big thing that I also did just most recently before I took this position. I do have a master's of arts in teaching, and I have what we call a prevention specialist 2 certification, which I do have to take classes for to kind of update it every year. You have to have so many, CEUs. So it's something that the state of West Virginia is trying to, excuse me about that. State of West Virginia is trying to definitely professionalize this. It is professionalized, and we want to encourage students as well to know about these type of things, but also increase that workforce that we might need in West Virginia to address substance use, address mental health issues. So the West Virginia Collegiate Initiative to Advance Healthy Campus Communities, as I said, I know some of you are members of that. It's basically a coalition of colleges and universities from across the state. There's only several really that don't participate. Several community colleges that just may not have quite the capacity to participate, but for the most part, we have pretty good participation and ideas to promote, mental health and substance use initiatives within the individual campuses. Let's see if there's anything else there and This is some of the student leaders that I worked with this year. We had a project, actually is, I think the one from Glenville is on there. Yes, I do believe she is. They went to a conference, or actually, I think they went to the WVCIA meeting there. It was the summer meeting. But so I have students that from 10 different universities, and basically the things I'm going to show you are the things how I work with them, how I work with them to plan, how I work with them to do a project. So they name themselves CLEAR. We worked on that. So that is Collegiate Leaders Empower Active Resilience. And they did that logo themselves. One of them is actually a marketing student. And so she did the Let's Be Clear logo. So some of our goals with them, improve for them to, on their campuses, work to improve student mental health, prevent substance use, encourage harm reduction, and support recovery. I did forget to mention I've been in recovery for many, many years. I don't even like to say how many because just ages me. So I have, like, that's the thing that's kind of just interesting, is I have experience across the board and very passionate about doing this type of work. I did put this slide together because I thought it was interesting to just think about just some little hints, because I did learn, I've done a lot working with high school, I've worked with all ages of youth, and working with college students. I'm also the mom of a college student, so I have had to tweak the way I approach things, even with my daughter, because, you know, as they grow and change, that you have to kind of grow and change with them. So I'm not going to go too much into high school, as much as it's just more of a comparison. You know, like in high school, you want to be a model. In college, you want to be more like an ally. But some of the things that I have pinpointed since I've been working with college students this year is offer experience and artifacts for a future career. So in other words, the incentive is you can put this on a resume. You can use this to get into grad school, you know, that kind of thing. High school students are very easily, they want to have, there's the real go-getters who want to have, you know, a college application thing to put on there that they did. If your student comes up to you and wants to do something and it will double duty for like a class that they're doing or a project, that's a really great way to put them together and actually incentivize what they're doing. Find a champion. So with WVCIA and with our student leaders, we have I call it a campus liaison, campus champion on each campus that connects with the student, and they work together to kind of do some things to enhance what they're already working on, and then some of the things that the student's bringing to the position. They love to network with people from other colleges. That's one thing. Like when they went to that conference, they left there best of friends. They loved it. So I try to definitely do that. If the colleges are near each other, I try to hook them up so that they can kind of work together. They're very busy, so you have to be very supportive about their time, but also set boundaries, because they are hard to get a hold of sometimes and pin down, even though like we actually pay ours. Ours are paid on an hourly basis. I don't call them youth, I call them students, because they are adults. College, high school, I would always say youth, but I've tweaked that. They can work independently. I'm very big on training, which our student leaders have had a lot of trainings. So this is my getting into the more meat of what I'm here for. Many times, and I quoted myself, many times students think in terms of, oh, we should do this activity. And actually, a lot of community coalitions start with, well, we want to do this, this, and this. So, and my question would be like, well, okay, why? Or is somebody else doing that? Or what is your actual like community need? Have you looked at your campus and have you prioritized what those needs are? So a lot of times with students, I notice that they definitely put the horse before the cart. And so one thing I do is I'm like, okay, let's take these and put them aside for a minute, your ideas about what you want to do, and let's evaluate your campus. So that is what the next part of here. So the first thing I would do now, because when Carolyn asked me this, she said, okay, if a student came up to you, what would you do? And so this could be, if you're just a professor, like I'm not sure everybody here who's here, but if you're a professor, your first instinct might be, I'm going to send them to the counseling services, which in some cases that might be the right place. But in a lot of campuses, I would venture to guess that's not the right place. Counseling services are so busy doing the counseling that they're doing that they don't often always do some of these other things, but there might be somebody else on campus already doing that. So then when we talked about it, I just felt like really with any student, I would probably still do the same thing. I would take a walk through the SPIF. Now, when I work the SPIF as a county coalition, I don't necessarily, I go into a lot more depth than I do with the students. I just want them to have an understanding of it. I want them to do parts of it that will, enhance their work and enhance their understanding of why they're doing that work and what's going to make it more effective. So this is, if you're not familiar with the strategic prevention framework, and I tell them, I'm like, if you've never done a strategic plan after you work with me, you can say that on your resume or in a job interview, you've worked on a strategic plan. And it's, it's something that not only do they use in prevention, but if you want to write any type of grant, it's a great thing to follow. There are lots of even for-profit organizations that have a strategic plan, and this is a really good way to just to look at it, a good formula to use. Sustainability and cultural competence is an area which I don't know if we're going to have a lot of time to go into that today, but that's something that's also supposed to go throughout. That just means if you create something, how can I keep it going? Basically, whatever, if it's a coalition, if it's whatever it is. And then cultural competence is making sure that everybody is, you're reaching everybody. You're reaching people who are speaking a different language or who are not, who are LGBTQ, whatever it is that you need to have. You want to make sure that whatever you have is accessible to all of them. So we're going to start with assessment. So that's the first part. So even if when they come to me with their ideas, okay, well, this is because I asked for a plan and the plan was activities. So I said, okay, well, let's start from the beginning. Let's look at what that means. So assessment for them, I had each of them. And if some of you are campus liaisons, you've done this with them. We did what's called a SWOT analysis that looks at strengths, weaknesses, and these are on your campus. And then opportunities and threats are from the outside, whatever your catchment area is, but in this case, it's campus. So you can, so then you can kind of look at that and see, first of all, the thing that your student wants to do, is that in here somewhere? Is there a part of that in here? And you're looking at your resources that you have, you're looking at, you're kind of, it kind of helps you to prioritize what's going on in your campus. And also to, I just want you to know, Jay, that I have, since you made me a coach,
I got co-host,
I'm letting people in, like when they come up. So
that's okay.
I just wanted to let you know. But yeah, so, and this is a fairly easy way to do a type of assessment because it's really just talking, the student knowing what they know, talking to other students, talking to someone who is a little more in the know on the campus. Like that's why I hook them up with their student, with their campus liaison, because they can together, try to formulate some stuff. And then I encourage them, like, well, if you don't know, look, Google around, see what's on your campus. And then for as far as opportunities and threats outside of campus, same thing. We'll kind of get to that as far as, but how can, if there's something they want to do, but there's an organization outside campus that can help them do that, and usually those community organizations are very willing to help with the college in their catchment area, in their county. So that is something that also, if a student wants to do something and a way to empower them to have them partner, is that. Okay, so I think that most people are fairly familiar with SWOT these days. I did it with a student. One of my students was so excited because she had to do it for a class. And she's like, oh, I'm going to use the one we did together. And I thought that was really great because she already had that. Okay, for some reason, my slide is not forwarding. Okay. I'm just going to real quick stop share and start it
Okay.
again. See if
No
I
problem.
can. Forward. Okay. Still not forwarding.
If you, yeah, if you look down to your left, yeah, there you go.
There you go. Okay.
Yep.
Okay. So that's okay. Assessment. I should actually, okay, there, now it's working. So the other thing with assessment is looking at data. So if we have actually on the WVCIA website, we do have what's the Acha data, which many of you may be familiar with, which is data that deals with substance use, mental health, and those type of issues. So I also had them look at that. So when they came up with their 3 goals for me for planning, they used their SWOT and they looked at data. Do I have data? Because that's a way also to see if you're making progress. If your data changes, then you can also do that. It just helps a lot with actually strategic planning and knowing. A lot of times in a community, people will come in and say, we need to do this. And then when you really look into it, that idea that they had is either already being done or the need, there's not really a need for it when you look at it, or the need is something similar that you can kind of tweak a little bit. So actually looking at what's happening on your campus is just so important. So then the next step is building capacity. So building capacity is partially that SWOT about opportunities from the outside, because whatever you want to do, you want to obviously get this. To me, if a student just approaches you and wants to do something, this would be a really important, as almost like the most important thing, because you want to get them to the person that can help them and empower them to do this. So I put Robin from WV West Virginia State University, because she is a very great campus champion. If you know her, she's just very involved, and she really, does a lot of youth run things. But you want to find that person on your campus. And you might even just think right now, just as an exercise, you can think about that. Who on my campus would I contact? And if you don't know, then, find out. A certain campus office that might help with that. It could be the wellness, it could be the counseling, it could be student activities, it could be the student government, boards, it could be student organizations, social work club, psychology club, anything. Some campuses might even have sort of student coalitions for substance use or mental health type of activities. And then community resources, again, just having done community work, I know that there are a lot of resources out there that are dying to get on your campus and help. And I know that they have I will say this, not all counties, but many counties do have somebody that's actually really wanting to get on there and provide you with information. Most of the if you have a family resource network in your county, if you Google that, this is Ohio counties, because that's where I did my coalition, but they have resource guides of everything in your county. It could be, so if something's not available on your campus, it might be available off your campus. And if somebody can't get, it usually has everything from like unsheltered to food, providing food, to treatment for this or that, mental health, anything. It should be on those. And there's a website actually in West Virginia where you just click on your county, and usually they have them posted in there. But I really encourage the students too, and this is a thing that's different with our students now that you probably know, is that, I'm used to picking up the phone and calling the person and asking them and letting them know, because oftentimes if you send someone an email, they're just going to kind of disregard it, or, oh, I'll get back to that later, and then they never really get back to it. So I really encourage them. This is one of the hardest things I found with students, is to actually reach out to somebody and let them know, this is what I'm trying to work on. What do you have that can help us with this? What do we have that can help you with what you do? Really try to bring in partners, because the more partners you bring in, the more capacity you have to do things. You can do more, you can do it bigger if you have those resources. So to me, this is really one of the most key things that you're going to do if you have a student that has an idea for Okay, yeah. Should move along a little bit faster.
You're okay. You're doing good. You're fine.
Okay. So then, then from capacity building, the next part in this strategic prevention framework is planning. So that's where I had them give me their goals, and their goals were based on their assessment. And then once they knew some things about the community and community resources, potentially it was based on that. And we got some really thought out, smart goals, about what I made them. I did make I let them know I wanted one that was related to substance abuse. But I really think I would have got that even if I hadn't had pushed for that. But they, some of them really wanted to do suicide prevention or, whatever their thing was. And I really, so their goals were more like increase student participation in recovery services, decrease vaping on campus or whatever. It was very, it was specific, measurable and time sensitive. Those are the things we had to really work on that. We're still working on that a little bit. So then the next part, objectives, because I was like, so you have this activity you want to do. So you want to have this event. Say you want to have some type of tabling event. Let's just say that's a simple thing. What do you want to get out of that? What are you hoping that people are going to get out of that? Not necessarily your end goal, but I want to educate them. I want to provide them with resources. I want them to sign up for a certain thing I have. Whatever I need to know, what are your objectives for and kind of also makes them think about their goals. So you have this goal of reducing vaping. So what are the top things you need to do that? Those are your objectives, right? You want to educate students, you want to provide cessation classes, you want whatever it is that you want to do. Those are your, how you're going to do it. And then the activities are the specific activities. Then they do who's responsible and by when. So I have each of my student leaders. Now remember, again, they are paid. But if you have a student that wants to do it, that has a really good idea about a mental health initiative, they, and they can probably use this for a class, and if you want to add this to a class, this would be, to me, a great way to do that for a project. So the next part then after planning is implementing it. So that's a little bit, I think most of us don't need a lot of, students do need a little bit of a run through with this though. They do need to think about timelines and schedules of classes and holidays. That's a great way to also think about when you want to do things is like, do you want to have a big push for something before spring break? Do you want to have finals week? Whatever it is, you want to try to plan those to be in a good time. See. Yeah, just a list of things to help them implement there. Recognize their help. And then one thing to think about ahead of time is evaluation. How do we want to evaluate this? Because we want to show that, hey, we had this participation, everybody filled out an eval, they all learned something. And then, you can look at that's just for the event. And then you can look at overall if you have some other way that you want to sort of evaluate your program or your idea or your initiative. Did it move the needle? So I'm not going super into detail with these. Then, of course, whenever you get results, you want to share those results. You want to let everybody know this is what we did. And then these are just a few of the things that some of my students did do. Let's see, we've got the Mental Health Matters, I think was basically a giant resource event done. I think that was at West Virginia State University, if I'm not mistaken. I'm not even sure who's all on here at this point. The students at Wheeling University did a campaign, social. It was social media, but it was also they did a digital media where when people come onto their campus, they get the ad. So we had some funding available that they had applied for and got for that. And then you see there was a Narcan on Save a Life Day. there, University of Charleston on the bottom right-hand side. They did an event. I can't remember what it's called right now, but it had something to do with cannabis, and it was about taking care of this plant. It had a real catchy little title about that. I've seen it on other campuses too, just to provide information about marijuana use, about risks involved, that sort of thing. I was going to do a word about sustainability, but honestly, I think again, that was something that just, it is part of it, is that, okay, how can we sustain this? The more partners you have, the more community support you have, the more chance you have to sustain that. So even if you don't have the money, you have the partners who are willing to do certain things. That's huge in community work, and I would think it would do as well. My resources, most of this is just stuff I know. There are a whole set of primers from CADCA, which is CADCA. Oh, Chelsea Collins. So you can, if anybody has anything from, anybody needs anything, I think I put my email on here. Again, my slide is together. Sorry, I just threw in some pictures. My email is there, polinskyM@marshall.edu. I also put my personal email address. If you need any information, help, or you have a student and or any of that, I'd be happy to help with that. So are there any questions?
Thank you, Martha. That was great. Yeah, please feel free to unmute if you have a question or put it in the chat, but I can get it started. I was just curious, how many projects do you do, like on average a year, do you think?
Well, this isn't, my project is new.
Okay.
So I don't know that I have an on average, because this is sort of a pilot project. There is another group, it's called CSPIF, which is Collegiate SPIF. We just talked about the Strategic Prevention Framework. And they do the Southern universities, mostly in West Virginia. And really, I mean, there's a lot can get done. I would say at least, 2 to 3 things a semester, happen. And if not more, it just depends on as well. Like if they have a lot of support from their college and from their campus liaison, they're going to get probably, and the more things I really encourage them to partner with other organizations. Like, don't just do this yourself. Maybe the Greek Life would want to go in on this with you, or maybe it's partnering within campuses like that, so that you're really expanding everybody's reach with what they want to do.
Gotcha. Thank you.
Martha, thank you so much for sharing that model. I think that not just with these projects that you were talking about in West Virginia, but I think there's really a big move on campuses for student-led mental health and substance use programming. And I think students have a lot of ideas, and there's a lot more opportunity for students, like you were talking about at the beginning, to meet other students and kind of share what they're doing on their campuses and communicate with students who have tried things on other campuses. So this is really good to have this model available to help kind of walk students through. And I think what you shared at the beginning is probably exactly what happens. Like, students come to the counseling center or other faculty or staff with an activity or a thing they want to do. Like, I want to do this. And so it's really helpful to see kind of how to walk them through that bigger process of, okay, well, why do you want to do this? And are you sure this isn't being done? And who else could help you do this? And how could you build in sustainability so that when you graduate, this can still happen? So that was really great. Thank you for sharing.
Thanks. I do think some students probably see a gap due to their own experience. Like, I had this happen and I tried to, or I saw this happen to somebody, or it, so in some ways that is probably is something that needs to be addressed on their campus, unless it is already. So yeah, I think that's what's kind of neat about it. It's just that they're right there, so they obviously saw a barrier.
one thing that we've talked about both in Project Echo as well as in the counseling center director groups in the past couple of years is the difficulty that some schools are having with getting students to come out and attend. So if the counseling center or another department is putting on an awareness event or mental health event, they're having some trouble. Some report having trouble getting people to come out, students to attend, and involving students from the very beginning in this, I think, is a great way to kind of combat that and make sure that the students are driving the planning of events. Like you said, Martha, when they've noticed a gap, it's something that they want to see addressed. And hopefully the students then can help get the word out and get people there.
One thing I'm very, just from having my daughter be at college and be there during COVID and she's just finishing up, is that connectiveness that they're lacking now, you know, that connectivity with each other. And, you know, just the differences of, you know, when I was in college, you know, you opened your door and your music was blasting and you knew immediately who was down your hall, what they liked, because you could just hear it. Where now everybody has their earphones on and they're here, that they are having a hard time connecting in the ways, you know, and some of the ways that they're suggested to connect just aren't kind of pulling them in. You almost need to do a lot of like, and I mean, it seems to me, and from talking to my students, a lot of individual, like just pulling people, just kind of organizing them together to try to bring them together and connect.
Any other questions or comments? Don't see anything in the chat.
Stop my share.
Martha, thank you again for coming on and presenting. We really appreciate it.
Thank you.
We're going to go ahead and transition into the discussion forum with Carolyn. So just give me 1 second, Carolyn, I'll pull it up and then you can just walk us through it. All right.
I also want to say that this is a general discussion. And so since we're a smaller group today, if anybody has something specific that they want to bring up, please feel free to jump in and co-opt this discussion. If there's something that will be helpful to you, maybe that this triggers in your mind. So I had background information is really, this is loosely tied to Martha's discussion about empowering students, but a real specific situation. So when a student or another campus community member dies by suicide, often the surviving friends or even family, if they're local, may want to host a memorial or sometimes a vigil or other ceremony on campus in that person's honor, kind of in the immediate aftermath of the death. And so sometimes, either if you're a mental health counselor on your campus or a student affairs staff member or even another faculty member or staff, you may be put in the position to assist your grieving students with an event like that. And so I wanted to just ask a couple of questions around that, how campuses, what their postvention policies. I know campuses are required or encouraged to have postvention policies around suicide deaths. So what do your policies recommend when you're handling requests for memorials after a death? And that can be whether it's a suicide death or a death from another cause. How would you empower students in this situation while still maintaining safety and upholding what we know to be best practices around postvention? What resources are needed to help students when another student has died? And are there any schools that have student leaders like the people that Martha works with, or RAs or others on your campus that are a part of suicide prevention planning that includes any discussion of what you'll do if there is a death by suicide on your campus? So Those are kind of my questions. I have checked there. There could be lots of different departments that are involved when there has been a suicide and involved in the response on the campus. Some others that aren't listed there too, I think could involve the media team for the campus, because there's usually a message that goes out to students. The behavior assessment team, oh, we've got threat assessment team there, but if there's a behavior intervention team, they're often involved as well. So those are my questions. I don't know if anybody has any thoughts to kind of get us started with that.
We have been very fortunate at Glenville to date. We have not had any completed suicides. I've been here 15 years. We did have a serious suicide attempt this past spring where an individual jumped out of a dormitory, did survive, is doing well now, but did, of course, not return to campus and the like. And we just basically offered extra hours in the counseling center. We didn't do any type of memorial service or anything, and again, a post-vention, a post follow-up for a suicide would look different than for an attempted suicide. Again, you don't want to glorify in any way what was done, but you want to offer support and give people, an avenue to be able to express what they think and how they feel. But we have had probably about 6 memorial services in the last 15 years. I got here in November 15 years ago, and within 3 weeks, 2 young athletes were killed in a car that flipped over. And we had a memorial service. If anyone's ever been to Glenville, the vast majority of our memorial services have been car accidents around our campus. Probably all of those that we've had on campus we had one young man who died of a heart issue in an athletic facility. But typically what we do, the campus community will come together. We will open up the counseling center for extra hours. We will have a memorial service. We will open it up to people to be able to come and share and speak. We have typically had candle type vigils and the like. And to have some sort of closure. We even had a young lady who had graduated the previous semester, but all of her friends were still on campus. It was a crazy situation where a log truck rolled over and the log came off the top of the log truck and landed in her front yard and crushed her on her way to get in her car to go teach school that day. It was very, very tragic and crazy the way it happened, but we even had a memorial service for her. To date, they've been fairly successful. And then, of course, we just make counseling available. But yeah, we do have memorial services on campus. We'll typically have a local pastor who may come and share and offer prayer and allow students to get up and speak. And I hate to say you have a successful memorial service, but we've had several. And we keep candles and everything. And different things available for those situations, and just hope we never have to use them. But that's been our experience here at Glenville.
I don't know if anybody just kind of sort of on something I said is like sometimes there are community groups as well, like NAMI. I know Wheeling, we have a NAMI chapter there, or there's a West Virginia suicide groups as well that if you ever do something like that, might be good to reach out to them for kind of suggestions and things like that.
And there is an online post-vention guide for suicide. That might have been what you just posted there, Carolyn. I'm not sure.
Yeah, I just posted that. So that's put together by Higher Education Mental Health Alliance project. The one that I've seen there is a few years old, and some of the resources in there are also a few years old, but it has very detailed suggestions and kind of best practices for colleges after a death by suicide, and kind of goes into detail for lots of different potential scenarios. It even gives like a sample message from your president that you might send out to people who are impacted by the death. It talks a little bit about memorial services and best practices around how to kind of work with students if they come to you wanting to have something like that. There really isn't a real clear cut answer for these things, because you also are working with the family and the family's wishes, and there may, well, while you might discourage an event from happening on campus, the family might be in the community, and there might be a big event that a lot of students attend, and so having safety around that is a consideration. So it definitely seems like there's a lot to consider. And Tim, like you were talking about having things in advance, having these discussions in advance before an event like this would ever happen on your campus makes it a little bit easier to deal with such a hard situation. Oh, Sean, sorry, I just saw you had your hand up. Go right ahead.
That's okay. I was just wondering, like I understand that most of the deaths that occur amongst the younger people to college are suicides, but it seems like there's a delineation between a memorial service for someone that dies of everyday occurrence and someone that takes their own life because of a suicide. In today's modern world, with terminology being taboo, how is it that you're able to talk to the students about suicide without causing an issue using the word itself or the connotations that brought up with it? Does that make sense?
I know I just had a QPR. I'm sure a lot of you have had that. I hadn't had it before, actually. And that's one of the things they talk about, is not saying committing suicide. So using other terminology for that.
Typically what they will, in the QPR, I'm a QPR trainer, they'll have you say a completed suicide rather than, committing suicide. With like, and again, one of the biggest conditions about addressing it, period, in memorializing is, again, to be able to address people's feelings and the situation as positive as possible without causing a contagion. And I think that's one of the things addressed in that post-intervention guide, that you don't want to create a contagion where you glorify someone or their life, you commemorate, but at the same time you try to inoculate other people from doing the same. I know we had a local high school in the next county over 3 years ago. We had 3 students within a matter of 2 months, 2 completed suicides and 1 attempt, 2 of those as a result of the first. And so that's one of the biggest concerns. And also, if you know somebody who's committed suicide or completed a suicide, that increases the likelihood that you will attempt suicide yourself. So just knowing and having a friend who completes a suicide increases your likelihood of doing it yourself. And so those are things you really, really have to watch. But at the same time, it has to be addressed. I mean, we have to get the stigma away from it if at all possible, so we can address it and talk about it.
Yeah, I've noticed recently, it seems like they're even bleeping out the words on social media, or like you can't even say it. Like, I mean, there's certain songs where they bleep it out, as if it was a curse word or a derogatory term in another sense of saying. But it just seems like the stigma of it is that, we're just going to hide it and not talk about it. And it doesn't allow many people the opportunity to express their emotions and come out in that situation.
In the QPR training that we do, we use the suicide word, and bottom line is the whole idea behind QPR is when you even ask someone if they're considering taking their life or suicide, a lot of people would think that bringing it up would actually, the myth is that by bringing it up you would be giving people ideas they didn't have. It's not like anyone's going to say, "Oh shit, I didn't think about it until you mentioned it. Now I'm thinking about it." I mean, they either are or they aren't. And sometimes just by bringing up the word saying itself, you lower the stress level because they know that you're willing to talk about it. Does that make sense? Just by saying the word, you're making it more acceptable to talk about.
Yeah, and I wholeheartedly believe that situation. So like it kind of does shock me to see that there is so much taboo around the word, because it does put people in a place they don't want to talk about it because they don't want to feel wrong, I guess, even though that their feelings that they have need to be expressed and dealt with so that it saves somebody's life potentially.
I think my understanding is that it was around the word commit, not so much the word suicide. So, yeah.
We did have a young man on campus this last year whose mother took her life this summer. And so when we had to stop the stigma walk this fall, which was really good because I found if you can contact the coaches and put the bug in their ear, a lot of times you can get the teams out. So we actually had over 150 participants, which is probably about 25% of our on-campus showed up for our mental health awareness walk and stop the stigma. And this young man actually got up. And we reviewed it with him, but he got up and spoke about his mother's suicide this summer and how it affected him and the like. And I thought that was really good, allowing a student to be able to talk about it to other students and address how it affected him and his mother's life this past summer. And I think it was also healing for him also to be able to discuss that and to share that. It's got to come out of the closet, or it's not going to get any better.
Yeah. I think last year for fall semester, we had a suicide prevention class, and NAMI and Wheeling, I think, showed up to do a course on it. I think they had maybe 13 participants, and they were ecstatic that there was that many out there. It's really sad that we don't have that kind of support to help the individuals that actually can use it.
Something you brought up, Tim, reminded me in that HEMA guide for postvention, it gave the suggestion, like you're talking about, that if students are wanting an on-campus memorial after a death by suicide, that it can be more effective to have kind of like one annual event where they may be able to speak, like your student who was a survivor from a parent's suicide, than having individual memorials immediately after. That can be kind of like a safer model. And so that kind of goes back to my question around empowering students. If students are wanting to host a memorial, and you can help them kind of look and assess and see, okay, well, we do have this annual event that is to reduce stigma. Would it be appropriate to ask them to help plan a piece of that, or to incorporate the memory of their friend or family member at that event? It seems to be a model that's safer for people than an immediate memorial.
It's funny, we did that, but I didn't know that was a suggestion. So it's nice to know we did it and it was the right thing to do. One other thing we have done, and I'm very pleased with this, is both me and my co-counselor are both QPR certified, but we have a class that everyone at the college has to take, at least for now. It is first aid and safety. So it's CPR, first aid, safety, and the like. And we've talked to the instructor there, and starting last semester, every one of her classes, we are presenting QPR from here on out. So everyone who will get first aid and safety will also get QPR as part of that first aid and safety. It's not part of the Red Cross, but we're throwing it in separate and doing that.
Any other questions or comments? All right, hearing none. Thank you, Carolyn and Tim and Sean for the discussion. That was great. We've got about 5 minutes left. I wanted to share a couple of things with the group. So the first thing, I'm going to share my screen. We've got the schedule for the rest of the academic year here. Oh, well, hold on. Let me do this. There we go. So we will not be having a session in January. We're gonna, because of the holidays, so we're gonna meet the next time will be in February 6th. So if there are any questions or anything that comes up in between now and then, please reach out, since we will not have a session in January. This document will also be uploaded into the iEcosystem, so you'll have it there. We'll have it posted on our website, so there'll be multiple places to get it, so you can see what's coming up. Carolyn, I don't know if there's anything you wanted to add on that with the schedule, but pretty straightforward. It'll go till May. And lastly is just that in the recap, there is going to be an evaluation link like always, but we just really want to encourage everybody to fill that out and provide any feedback that you might have, good, bad, or indifferent, whatever it is, we want to know. So we encourage you to do that. But if there isn't any other questions or comments, we'll go ahead and adjourn. All right, everybody. Thank you again to Martha. Thank you, Carolyn,
Thank you.
again. Happy holidays to everybody. We'll meet back up in February of 2024. Hard to believe. All right. See ya.